This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, did you have any thoughts on an article, but there was a recent interview article in which an artist stated that she believed IVF caused her cancer. We'd love to get your opinion on this.
Yeah, no, I think it's something we can talk about. Does going through an IVF cycle increase your risk of cancer? The problem is that any woman throughout her lifetime probably has a 10% chance of developing a cancer. Breast cancers are not quite 10%, but it's certainly up there. And the other rarer forms of cancer, obviously, cervix and ovary. So if someone's been through an IVF cycle and they happen to get cancer later on, they're obviously going to think that maybe it was the IVF cycle that did it. But there's now quite substantial evidence that's not true. In fact, there is out of the evidence, it seems that some cancers are less likely if you've been through an IVF cycle. As for instance, cancer of the uterus, the lining of the uterus, is actually less if you've been through IVF. And that's probably because you end up being fertile. And there's certainly a relationship between infertility and endometrial cancer. And the reason we are confident about this is massive studies that have been done. In Scandinavia, Denmark, Norway, Sweden, there have been, for the last 30 years, registers kept of every patient who goes through any healthcare system. And so they can log on and actually look at the various treatments or therapies that people have had and then link it to cancer. And these massive studies out of Scandinavia show there is no increased risk of cancer. And as I said earlier, a couple of things are probably less because you get pregnant, not because of the IVF, but probably because pregnancy protects women from cancer in the future. So this lady may think that, but the evidence does not support it. We're in fact involved in, and the University of New South Wales, involved in a registry study which involves Australia and the Scandinavian countries. It's now about 80% done, and it'll be interesting to see what those results are. But the first indications are that what we saw out of Scandinavia is being confirmed in this particular study.
Do women undergoing fertility treatment who experience stress have an increased risk of heart health issues during pregnancy?
In terms of stress, all women who go through an IVF cycle get stressed. The desire to have a baby, to go through all of the medications and all the treatments that are required to get you pregnant with an IVF cycle obviously is stressful. But does that roll over into pregnancy? Those people who are stressed, and obviously there are people who are women who have an underlying stress issue, pregnancy doesn't help that either. Women who are badly stressed during an IVF cycle may be stressed during pregnancy. In terms of the outcomes, stress that probably doesn't make a major difference. Obviously, it makes the whole experience of pregnancy and the baby afterwards a more difficult time, but it doesn't actually make the baby healthier or less healthy. And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.